most famous physical therapist on the internet.
Well, hi there, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
The question of the day, Brad, can
Yeah.
my rotator cuff tear heal? So you got a diagnosis. You found out, they say you got a rotator cuff tear, and you're like, oh my God, what do I do now?
Now I need surgery.
Now I need surgery. Not necessarily, not so fast.
Right.
First, I want you to understand what the rotator cuff tear is, because I think a lot of people think it's muscle, and it's not muscle. So the rotator cuff is made up of 4 muscles that surround the shoulder.
Sure.
And this is actually a shoulder blade.
Should we
we
give some reference here?
Yeah. This is the shoulder blade. I'm pulling it right off here. There's 4 muscles that surround the shoulder blade. They help the shoulder move, but they also stabilize the shoulder.
Mm-hmm.
They help hold it in the joint. Now the tear occurs not in the muscle here. That's the brownish part here. But the muscles narrow down and become a tendon.
Right.
And that tendon, you can see this tendon right here, attaches to the bone. Now, the tear can occur in the tendon. It can be a pinhole.
Mm-hmm.
It can be a complete detachment.
From the bone?
From the bone.
From the bone.
When that happens, more often than not, you're going to have surgery. Although Brad and I were talking to people that didn't have surgery and still got by.
Right. Amazing. But, you know, they're not high level.
They're not high level.
You know, they don't need to do a lot of overhead activities and things like that.
And that's one of the things if you're trying to decide if you're going to have surgery, what are you going back to? Are you going back to sports,
Mm-hmm.
where you're going to need to have high level motion? Are you going back to a job where you're a laborer or something where you really need to have overhead motion? So that's one of the questions.
I just wanted to point out, Bob, there's 4 muscles that make up the rotator cuff, but the supraspinatus, this one on top that we have highlighted and Bob pointed out, is the one that the majority of the time is the culprit.
Is the one that's torn.
Right.
And why don't we show impingement, Brad?
Right.
Why does it tear? Why do tears occur? Yeah, quit eating the pen.
Yes. So here we have the shoulder, and we have this tendon for the supraspinatus that Bob was talking about.
Just talking about.
Highlighted with this pinkish color tape. Now, if you look at the acromion, this bone right here, and we go up, right, can you see? Can you get on that? Right there, it's pinching. Now, if the rotator cuff and all the mechanics are working well,
there's room.
Yeah, the joint drops down and then it goes up and there's ample room. But if things aren't working properly, it pinches just like a nutcracker.
Yeah, if you put the pen in there, Brad.
Oh, yeah.
And go like that, I could actually crack the pen.
We should try the peanut thing in there.
Yeah, we should.
That's an inside joke, but unless you watch a lot of our videos. So anyways, when that gets pinched, a lot of times, a couple of times pinching is no big deal, but if it's repetitive, time after time, day after day, week after week, it can wear that tendon down and eventually fray it like a rope, and that can be partial tear, and it actually can go right through possibly, or if you fall in a real abrupt incident could, tear it as well.
So that's one of the questions you have is like, if I have a tear, do I need surgery? Well, one thing is, what are the conditions going to be of the shoulder? Are you have impingement and you're going to continue to tear that shoulder? Because that tear could get bigger and bigger. Mm-hmm. One of the questions that surgeons ask or will use to determine whether or not to have surgery is how big is the tear? Mm-hmm. The massive tears are unlikely to heal. Mm-hmm. It's a large tear. So in those cases, you may need to have surgery. Also, as the case with everything almost, Brad, the older you get, the less likely, the harder it's going to be to heal.
Sure.
So like a tear in our shoulders, we're probably doomed.
Well, I wouldn't say that. But at the same time, if you don't have surgery and you can work some, therapy and strengthen the muscles that help that, you can, it's amazing how the body can compensate.
Right. In fact, that's a good time to mention a study, Brad. So there's a recent study, 167 patients, and this was done in, I thought, Finland. I didn't write it down. So what they did is they compared physical therapy. The patients received physical therapy versus surgery, like arthroscopic or open surgical repair. Mm-hmm. What they found out is that if that the results were pretty much equal if they had the surgery or if they had physical therapy.
You mean the functional results?
Yeah, the functional results.
That must be assuming they weren't high level.
Right. You mean that they were not a complete tear? You mean like,
or they weren't like a pitcher throwing a ball,
right,
or they're doing
right,
a lot of overhead.
right. But they were equal. I think these were just the average functional person.
Right, sure.
So, but before that, and we're going to have a video on what questions you should ask your surgeon, but you need to ask your surgeon,
You're right.
is this, is it going to heal if I have the surgery? Because sometimes it won't even heal even if you have the surgery. Is it going to get worse if I don't have the surgery?
Right.
All these questions you need to ask.
And if you don't like what your surgeon says because you don't want to have surgery, I would not hesitate to get a second opinion.
Almost always get a second opinion. In fact, you don't necessarily have to go see another surgeon. You might just send the MRI results to another surgeon and say, hey, I want the second opinion. Very common, very amazing how often sometimes you'll get different opinions.
Oh, yeah. We had, as a matter of fact, we did a video on this woman a few years ago. She was in her 50s, scheduled for a rotator cuff tear surgery. She did not have therapy. She said, can I do therapy? And the surgeon says, well, okay. And she went, and after about 2 weeks of therapy, her shoulder started getting better. She canceled the surgery. And she actually worked at that facility. Years later, she was so happy because she was working just fine. And so make sure you at least do some therapy. Or
if the surgeon says, like, again, if it's completely detached, maybe in that case, and if it's going to get worse, you have to determine that, and that's when you're going to get the second opinion.
Right,
probably.
And if you have two different doctors saying you need surgery, well, they probably are right.
Right. How do you know that it's getting worse? This is very simple. A lot of times the pain is getting worse.
Yeah.
So that's usually the sign of a large rotator cuff tear. Again, pain at night, symptoms. If the symptoms are getting worse despite you having physical therapy and medication, that might be a sign it's getting worse too.
If you're trying to lift your arm like this, and this is about all you can do, boy, that's when I have a patient doing that, and I'll do a few other tests, I'm thinking there's a pretty good chance it's a pretty serious tear. But
although sometimes they get so inflamed at first.
That's true. So you got to be careful.
I did have one, Jay, who invented our thing. He started off really bad.
Like
I didn't think he's up like this now.
And how old was he at the time-ish?
He was late 40s, I think.
Yeah.
So
there you
pretty
go.
Amazing.
So there's the body can really, really work some things as well, as long as you got a good therapist, of course.
Now we're done with this video. This video, if you don't realize it, is part of a series of videos on shoulder pain and recovery and rehab. If you go to our website, bobandbrad.com, go to the program section, look under there, you'll find the one on shoulder injuries and pain.
Right, and there'll be a list of the different videos, so you can pick out the one so you can very quickly go to the information you're specifically looking for.
Yep, and it also has a printout with each
video.
The
PDF printout, so you don't have to keep watching our ugly mugs every time you want to
get
the exercise.
Thanks for watching.
Very good, thank you.